Ladies and gentlemen, this story came out on the Wall Street Journal, but it's something that many have been saying. When I first started doing stories on COVID, I had suspected that it started a lot earlier than March, and when all the chatter was going on. And many of my subscribers did too. Because I remember when I go back to my old stories, many of you were saying, no, I believe COVID was already here long before it hit the media. And look, it's turning out we were all correct. So now, technically, COVID has been going on for a year in the US, not the 10 months, 11 months that we've been talking about. A year. And they're saying that it started on the West Coast, ladies and gentlemen. Mm-mm-mm. So this is November 30th, 2020, the Wall Street Journal. COVID-19 likely in US in mid-December 2019, CDC scientists report. Mm-mm-mm. So they're saying that there is evidence of 106 of blood donations that were made on the West Coast that had the COVID virus in the blood. And these donations were made in December 2019, ladies and gentlemen. And who knows, it could have been before December for all we know, right? Amazing. All right. So I'm going to play the audio here for Wall Street Journal.
Report. New analysis of blood donations finds virus was present on West Coast earlier than previously believed. By Betsy McKay. November 30th, 2020, 7:27 p.m. Eastern Time. The new coronavirus infected people in the U.S. in mid-December 2019, a few weeks before it was officially identified in China and about a month earlier than public health authorities found the first U.S. case, according to a government study published Monday. The findings significantly strengthen evidence suggesting the virus was spreading around the world well before public health authorities and researchers became aware, appending initial thinking about how early and quickly it emerged. Scientists at the U.S. Centers for Disease Control and Prevention found evidence of infection in 106 of 7,389 blood donations collected by the American Red Cross from residents in 9 states across the U.S., according to the study published online in the journal Clinical Infectious Diseases. The scientists based their study on blood samples that the American Red Cross collected between December 13th and January 17th and later sent to the CDC for testing to see if any had antibodies to the new coronavirus, which is named SARS-CoV-2. SARS-CoV-2 infections may have been present in the U.S. in December 2019, earlier than previously recognized, the authors wrote. A person's immune system develops antibodies when exposed to a pathogen like a virus to fight it off. Their presence suggests exposure to a virus. In analyzing the blood samples, the CDC scientists found antibodies in 39 samples from California, Oregon, and Washington state collected between December 13th and December 16th. The findings suggest there were isolated cases of coronavirus infection on the U.S. West Coast in mid-December, the scientists wrote. They also found 67 samples with antibodies in Massachusetts, Michigan, Wisconsin, or Iowa, and Connecticut or Rhode Island collected between December 30th and January 17th. Those findings indicated that cases were more dispersed, yet still isolated, by early this year. The scientists said they ruled out the possibility that the antibodies they found had developed to fight off other coronaviruses, which cause the common cold. They did that by looking for antibodies specific to the new coronavirus in 90 of the samples. They said they found antibodies specific to SARS-CoV-2 in 84 of the samples, or nearly all of them. The results add to growing evidence suggesting COVID-19 was present outside of China earlier than previously known. Researchers found the virus, for example, In a retrospective analysis of a specimen from a patient who was hospitalized in France on December 27, 2019, the first COVID-19 case in the U.S. was reported on January 19, 2 days after testing for the virus began there, the CDC researchers said. A young man returning from China a few days earlier suspected he might have the disease and sought care for his symptoms. 2 other people who were subsequently diagnosed in the U.S. also developed symptoms in mid-January. Earlier studies have also suggested that COVID-19 had moved beyond just isolated cases and was spreading in communities in the U.S. by mid to late January, though epidemiologists say that the virus likely didn't circulate widely in communities until later in February. The new study shows the value of screening routinely collected blood samples for evidence of viruses spreading in a population, the CDC authors said, adding that the agency is continuing to conduct surveillance for COVID-19 this way. Not only did COVID-19 likely appear in the U.S. earlier than previously known, but researchers have found evidence that the virus is far more widespread in the U.S. than testing indicates. Some 53 million people in the U.S. likely had contracted COVID-19 by the end of September, according to a modeling estimate published last week by CDC researchers. Roughly 6.9 million infections had been confirmed within that time period, suggesting that roughly 1 in every 8 cases was identified. Yet the majority of the U.S. population hasn't been infected. On November 24, a CDC study published in the journal JAMA Internal Medicine estimated that fewer than 1% to 23% of people in the U.S. had antibodies, depending on the location. Write to Betsy McKay at betsy.mckay@wsj.com.
Okay, y'all. So they're saying it was in the blood from blood donations back in December 2019. And that's how they were able to detect the fact that it was in the US previously from when it made it out in mainstream media, which I'm not surprised. I'm not surprised. And I know many of my subscribers are not surprised because some of you were saying that even back then in the beginning, because I remember seeing it. So, ladies and gentlemen, you know, like I said, America has done so bad on this COVID thing. It's not even funny. And it's not getting better at this point in time. They're now waiting for the Thanksgiving surge. Over 9 million people traveled during the Thanksgiving holiday, which means this week or either next week, you should see the next big surge in the country. And many of these states are afraid because, look, their hospitals are already at full capacity. Now you're going to have these defiant people that will now fall ill and have to run to the hospital, and the system is collapsing. Look, even here in my state, a lot of these nurses are like, I can't handle this anymore. And many of them are walking away nationwide now. Doctors and nurses, they're overwhelmed. They just, you just can't keep overworking somebody every single day. Eventually, yes, they're going to get sick of it. But y'all, please tell me what you think about this new announcement that has come out. Through blood donations, they were able to detect COVID back in December 2019. So we are going 1 year strong with the COVID virus. 1 year strong with this virus, y'all. And America is getting worse, not better. You know, I'm just astonished, but I guess I'm not, because I told y'all multiple times these folks are not good bosses. They weren't even good bosses in places of business. See, as long as nothing major is going on, they'll just roll right along. But see, now a curveball has been thrown in their direction and they don't know what to do. So we're 1 year in, and America is functioning like COVID just got here yesterday. But y'all, please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.